Hi, and welcome to this mini class on the clinical application of probiotics for chronic joint pain. If you have patients that are suffering from chronic joint pain and looking for additional strategies to help with the reduction of the chronic inflammation and pain, you're in the right place. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, where we specialize in teaching providers functional and integrative medicine. And in today's class, I'm going to start by diving into the gut and how does probiotic help chronic joint pain and inflammation through modulating the gut. And then I'm going to give you specific examples of professional grade probiotics that you can consider for your patients. So let's dive into it. In order to understand how probiotic supplementation might be beneficial for reducing chronic inflammation or chronic joint pain, we have to first look at our gut. And in our gut, we have an ecosystem, and understanding how our ecosystem or the gut integrity is designed to prevent chronic inflammation helps us to better understand all these important mechanisms. So let's dive into it. First, I'm gonna write here on the left side, I'm gonna write here gut. And here on the right side, I'm going to write joint. When we talk about the gut, there are a few factors that we have to remember. The first one, and probably most important one, is the gut bacteria. Now, the gut bacteria plays multiple roles. The first one is modulating the immune system by one of the pathways and mechanisms is by secreting by fermenting fiber and secreting short-chain fatty acids. So let's just say short-chain fatty acids. Those short-chain fatty acids, there's multiple types of short-chain fatty acids. We can actually, as you go deeper in functional medicine, you learn more about the different types of short-chain fatty acid, how to measure it in your patient's gut, and how to impact each one specifically. But for today's conversation, we're going to mention one major short-chain fatty acid, which is butyrate. And so those short-chain fatty acids, essentially what they do is they have an anti-inflammatory effect. So when short-chain fatty acids increase, you're having an anti-inflammatory effect, which is better for our joints, right? Now, on the other hand, so this is why it's important. Every time we eat fiber, we have the right type of bacteria in the gut, ferments into short-chain fatty acids, and that has an anti-inflammatory effect. Now, on the other side, we also have the gut barrier. And the gut barrier is essentially the barrier in which that helps to make sure that food particles, toxins, let's call it also bacteria, right? They're not gonna migrate into our bloodstream, right? So let's put this in brown. That will be the bloodstream, right? So this is the bloodstream. The gut barrier is really important for preventing those proteins, bacteria, and toxins from crossing into the bloodstream. Unfortunately, and this is what so many recent studies are showing us, when you have a state of dysbiosis, which essentially a state of dysbiosis, what it means is that you have either lost the beneficial bacteria or you have an overgrowth, what we call SIBO, small intestinal bacterial overgrowth, which essentially means that you have an overgrowth of certain bacteria that could be either considered non-beneficial, imbalanced, or even pathogenic. So any of those could lead to a situation that we refer to as SIBO or dysbiosis. The problem with that is when you have a reduction of the beneficial bacteria that are producing short-chain fatty acids, that leads to lower amounts of short-chain fatty acids. The amount reduces. Guess what happens when you have less short-chain fatty acids? These short-chain fatty acids are important because they help to control inflammation, right? And they also help to stimulate the activity, for example, or just as an example, of cells that are called Treg. And Tregs are T regulatory cells that are helping to inhibit certain inflammatory pathways. Now, if you don't have enough short-chain fatty acids, what essentially would happen is you are going to have less activity of Tregs. You might also have activation of certain inflammatory pathways, right? So now we are getting more of the inflammation, right? Now, that inflammation starts in the gut. So you might be asking yourself, well, Tal, how does that get into how does that impact our joints, right? So we got an indirect impact, systemic, that indirect impact that is starting in our gut by, remember that 80% of our immune cells are in our gut, 80% of the immune system is in our gut. And so now you have in your gut an inflammatory state, right? And that through certain mechanisms could impact the joints. Why? Because short-chain fatty acid actually cross into systemic circulation. If you have less of that, you have a predisposition for more inflammation. But another mechanism that explains that is the gut bacteria, the beneficial gut bacteria, is really important for maintaining healthier gut barrier. And under certain conditions of both inflammation in the gut and both dysbiosis, what will happen is there could be a loss of the function of the tight junctions. And those tight junctions essentially are those little areas in between the cells that control the passage of different proteins, for example, proteins, toxins, and also bacteria-related materials. For example, lipopolysaccharides is the structural compound of the outer membrane of gram-negative bacteria. And when you have dysbiosis, the balance now shifts towards higher proportion of gram-negative bacteria, such as Klebsiella or Enterobacter. And those bacteria then naturally shed their LPS, the lipopolysaccharides, during the overgrowth phase, or they release some large amount of them when they die. Now, in a healthy gut lining, that is most of the lipopolysaccharides is going to remain inside the gut and then eliminated through the bowel movements, right? However, what we're seeing essentially, if you have an inflammation and over time a dysbiosis that damages the bacterial lining, what we're seeing is the migration of a larger amount of lipopolysaccharides into the bloodstream and systemic circulation, where it binds to immune receptors like TLR4 and thus driving the release of cytokines, inflammatory cytokines, and that can stimulate or contribute to the arthritic, arthritis-like inflammation, right? So all of that, essentially, that lipopolysaccharides go through the bloodstream, encounters a strong immune reaction that is inflammatory, and essentially we are now having inflammation that is systemic. And with some patients that have predisposition for joint pain or osteoarthritis or joint pain in general, they are going to experience, it's going to contribute to their symptoms of joint pain. So this is essentially, we're talking about here the major mechanisms that are contributing to joint pain through the gut. So remember, I always say what happens in the gut doesn't stay in the gut, right? There are so many studies that talk about this gut joint axis, right? In which there are, if you have changes in your gut, then you also could have changes in the immune interaction or immune action response in your joints. Now, of course, there's multiple factors that impact that, and also there's also multiple types of axes. There is the gut endocrine axis, there's the gut cardiac axis when we dive deeper into cardiovascular diseases, explaining how and looking at the research on how some patients could develop cardiovascular diseases, and a key player in that is that chronic inflammation and the gut dysbiosis or gut loss of integrity or reduction of short-chain fatty acids. There are multiple things that can go wrong with those mechanisms. And so this is where we want to talk about how probiotics is beneficial. So essentially what probiotic does is providing the gut, our body, an external support, an external beneficial bacteria that could increase the production of short-chain fatty acids and have an anti-inflammatory effect by, for example, supporting or stimulating the function of Tregs, which have anti-inflammatory properties. So this is essentially how, in a nutshell, how probiotics help, right? They help to create a more healthier, more balanced environment inside your gut where you have trillions of different bacteria. So let's take a look at this really interesting picture. This is from a study published in 2020 in the Journal of Nutrients. And this kind of summarizes what we were talking about so far in the whiteboard. And so you can see on the top there's inflammaging or obesity. We're not going to get into inflammaging today. It's a very big topic, and if you ever want to really understand one of the major theories for accelerated aging, loss of function, and age-related diseases, inflammaging explains a lot of it. And then, of course, obesity. We have to remember that our adipose tissue is a metabolically active organ that interacts with our immune system on an ongoing basis. So that's really, really important to remember. So if on the left side you can see loss of gut biodiversity, meaning that you lose some species of bacteria in your gut, maybe through some harmful lifestyle or dietary choices that the patient is making, maybe through use of antibiotics, and then you have, or certain medication, and then you have loss of tight junction integrity, which leads to increase of inflammatory cytokines and increase of lipopolysaccharides, right? So that increase of intestinal permeability can now lead to circulation, excess circulation of lipopolysaccharides, which leads to a systemic immune response. And that could contribute to accelerate the joint pain and inflammation that the patient is experiencing. And this is so important to understand because so many patients go to see a provider. They are prescribed with either pain medication or NSAIDs or steroids, right? All trying to, with a strong focus on reducing, on managing the pain and reducing that immune overactivation, right? But in most cases, the patient continues to struggle. In so many cases, the patient continues to struggle. In some cases, patients need more and more medication, right? And we have to think about it in the functional medicine approach, right? We want to take a step backwards and ask ourselves what's driving that inflammation. And this is why we're talking about the gut joint axis, because this is one of the major player in that chronic inflammation that your patients could be experiencing. So here's another picture that gives you like a general overview. This again describes the gut joint axis. This is from a study published in the International Journal of Molecular Sciences in 2023, and it shows that interaction between the gut microbiota and osteoarthritis. So on the left side, you can see certain bacteria in our gut that were reported to be associated with osteoarthritis, such as Firmicutes and Bacteroidetes. And there are several of those bacteria. And as we go in the advanced functional medicine program, we dive deeper into the gut and we learn how to identify those harmful bacteria. And then we learn how to different treatment strategies to lead to a healthier environment and healthier function, right? To resolve the underlying cause. And you can see here really on the right side, you can see the major risk factors. So of course, obesity, sedentary life, the joint integrity is important, and genetic. Those are of course, predisposition for developing osteoarthritis. But we also want to look at, on the top, we can see that little graph that shows us that if your patients have a state of dysbiosis or loss of integrity of the gut, what will happen is they're going to have higher amounts of lipopolysaccharides. They're going to have higher amounts of the inflammatory cytokines, the interleukin 6, 1, tumor necrosis factor alpha. Those are all play an important role. So on the bottom left side, you can see the therapeutic interventions for gut microbiota that could be specific. There are certain specific strategies we're going to talk about in a minute for the patients with osteoarthritis or patients with chronic joint pain. And that could be probiotic, for example, prebiotic, which we'll talk about in a second. There's specific supplements, right? If the patient was found in lab testing that there is a state of dysbiosis that might need antibiotics, we would typically talk about in the advanced program about specific protocols from antibacterial herbal medicine that can help in some situation, and some functional medicine practitioners use antibiotics. So there's different scenarios and different situations what we might be considering those different therapies. But one thing is really important is always look at, when you got a chronic patients that continue to struggle, we have to look at the root causes, right? So what do we do when we have a patient with joint pain and we want to look into their help their gut, support their gut microbiome? So one, lifestyle and medical factors. So did they went through trauma? Are they having struggling with obesity or weight gain, right? Those are all important. They have recurrent use of antibiotics. Those all can disrupt the microbiome balance, right? And of course, if you want to learn more about strategies, root causes and strategies for obesity and overweight, we teach that in the advanced functional medicine program. Now, low fiber consumption or high consumption of sugar was also reported to be associated with gut dysbiosis. So if your patient doesn't consume enough fiber, for example, because they eat processed food, right? How are those gut bacteria going to ferment in order to synthesize short-chain fatty acids, which have anti-inflammatory effect? They can't. Our gut bacteria need, right? They need those foods in order to thrive and function properly. And then the probiotic supplementations that we're going to be talking about next are very specific for joint inflammation and pain. So when we pick probiotics, we want to be very precise. We want to target probiotics that can support reduction of lipopolysaccharides, leakage into the systemic inflammation. We want to make sure that we have probiotics that promote more fermentation of short-chain fatty acid. We want probiotic that can help us restore gut microbiome balance. We want the specific species, not general probiotic. We want specific species for specific condition, right? This is really what we call precision medicine. So when you want to help your patients in a deeper level, right, and get better clinical results, then you really want to focus on the probiotic species that were studied in clinical studies. So let's take a look at a couple of really interesting studies. So the first one is a human clinical trial, randomized controlled trial, 461 patients with knee osteoarthritis received the daily dosage of 12 billion colony-forming units. The probiotic strain is Lactobacillus casei shirota. The duration is 6 months. Typically, we're looking at 3 to 6 months, but here they use the supplementation for 6 months. And then the result was in the treatment group, they had visual analog scale improvement. They had another improvement in the Western Ontario and McMaster University Osteoarthritis Index, which measures pain, stiffness, and physical function. That the patients reported improved. And then they did a blood test, and they found that there was an improvement in high sensitivity C-reactive protein, levels reduced, which indicates reduction in systemic inflammation. This is a really interesting study, and I put the citation on the bottom so you can read more about it. Now, where would you find this particular Lactobacillus casei shirota? This one is really interesting. It's actually not sold in the United States in a specific supplement, but there is a company that has a patent process, and this is actually sold in a product called Yakult. This is a probiotic drink that was specifically designed for this species of probiotic, the Lactobacillus casei shirota. And it has about 6.5 billion CFUs per bottle. So to get to the dosage they used in the study, you would probably need a couple of bottles. You need 2 bottles to match that 12 billion CFU, colony-forming units. Now, here's the website where you can get it. This is something you can consider for your patients. We are not affiliated. American Academy of Functional Health is not affiliated with any supplement or nutritional-based company. This is based really on our own review of medical articles, and so you can check that out for yourself. One thing that I would mention is the disadvantage of this specific product is that it also has 10 grams of sugar per bottle, right? So it might not be suitable for some patients, like patients with metabolic dysfunction or type 2 diabetes, right? Or patients that are on a certain low sugar or no sugar protocol. That would not be appropriate. But this is, for now, the only product in the United States that actually has this very specific strains of probiotic that was tested in human clinical trial. Now, I wanted to give you another option in case you have patients that would just want to take a simple probiotic supplementation in a capsule form. This is an interesting study. This is from an animal and human osteoarthritis chondrocyte study. And what they found essentially is that Lactobacillus rhamnosus led to an increase in the anti-inflammatory cytokine interleukin 10 and a decrease in pain severity and cartilage destruction in rats model of osteoarthritis. So this one could be beneficial, might be beneficial for patients, something to consider for patients who are struggling with chronic joint pain, right? So again, we want to do whatever we possibly can to reduce the inflammation and also benefit those patients who are struggling with joint pain. And you can find these particular Lactobacillus, strains of Lactobacillus in, here's an example of a product. It's called Lactobacillus Multi-Strain Lactobacilli Probiotic by Allergen Research Group. And it's got a nice amount, 3 billion per dose, per 1 capsule. And so this is, again, something to consider to help those patients. As usual, we would always recommend to get better clinical results, to help your patients in the long term, to really improve their health, not just manage, going beyond symptomatic management or management of the disease. We're talking about health optimization. We always want to look at the root cause of joint pain. And today, I mentioned one of them, which is gut microbiome dysbiosis, loss of gut integrity. Those are some of the mechanisms. And if you want to learn more, check out our advanced and clinical functional medicine certification program, where we dive much more in depth into all the factors and root causes of chronic diseases, and have specialty classes on all of those joint pain specialties, joint pain and cardiovascular and autoimmune and hormone imbalance and neurological conditions, geriatric conditions. So we talk about all of those much more in depth. So thank you so much for watching. Thank you for helping your patients in your community, and take care in the meantime.